Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I am Katie Wyatt, your host. Today's episode is sponsored by the Learning from Lawsuits podcast. This is a podcast that I co-host along with Dr. Charles Pilcher. Each month, we review a real medical malpractice lawsuit case, discuss what went wrong, and what we can learn to prevent similar mistakes in our own practices in the future. This is definitely worth a listen for any healthcare provider. I have learned so much doing this podcast. Check it out wherever you listen to podcasts and subscribe to the Learning from Lawsuits podcast. Welcome to the Medical Manners Podcast. Today I have Anne Grill on with me. I am so excited to learn from Anne today. It's rare that I meet someone who is as passionate about this as I am, but Anne is that person. Anne and I chatted a couple weeks ago, and I could have talked for hours. Anyways, Anne, I'm just super excited to have you here. I'm going to read a little introduction about you. As a director of patient experience for Evergreen Health, Anne Grill helps to design and implement programs that improve patients' experience of care. In her 17-year tenure in this field, Anne has worked with hospitals, clinics, and agencies from coast to coast and has been regularly featured as a national speaker. Anne obtained her BA in communication from Michigan State University and her MS in health communication from the University of Illinois. So, Anne, welcome. What are we going to learn today?
Thank you so much. And I felt the exact same way about you. We could have sat on that call for hours just talking about communication skills. I love when I meet a fellow communication skills nerd, because we can just nerd out together and talk about all the things that we're so passionate about. So
definitely.
I was right there with you. Well, I thought a lot about this because I'm not even sure how many topics you and I covered when we had that initial chat. But the one that stood out to me is one that I've never actually presented on, but the more you and I discussed it, I thought this is really what I want to talk about. I want to talk about humility in healthcare.
I love it.
I put a lot of thought into this, and because I'm very much a list person, I made a list of things that I think are really essential to being able to weave that humility into our day-to-day work if you're someone who's clinical. But maybe we could start, since I already said that I'm a nerd, I did look up the definition of humility because I wanted to make sure that I was on the right track. And you know how sometimes you think you know what a word means, but always good to verify.
Totally.
And I really like this. It says the quality of having a modest view of one's value or importance. Pretty simple, right?
Yeah.
Kind of going like, I am not everything. I don't know everything. And that probably feels uncomfortable. As I think about the clinicians that I work with, that probably feels pretty contrary to the skills that they're taught to sort of exhibit when they're in front of patients. I do think it's really important for personal and professional development to be able to balance humility and confidence, because humility allows us to be open-minded, and receptive to learning, and confidence empowers us to do things like pursue our goals and assert our ideas. And those things, they might feel real opposite, but I do feel like they can work together in a clinician who's really thoughtful and really present, because I want, as a patient, to see someone who is confident in their own skills. And brings a lot of knowledge and experience to the table. But I also want someone who's open, and can share with me, like in the decision making, is going to accept that maybe there are limitations to what they've learned.
Yes. And I found I always train providers, be confident in what you know, but it builds trust with our patients when we are just as confident in what we don't know. And so we say that, I don't know, that's beyond my training. Let me help you find someone who does. And there's been so many times where providers have kind of acted like they know things that they don't, and trouble follows. And so I'm a big cheerleader of the fact that it actually builds trust with our patients when we are confident and then we also admit our boundaries.
I completely agree. I think that having the wherewithal to acknowledge something that we don't know and to admit that, to be able to say, transparently, I am not the expert in that. I think it's important. I'm really glad that you asked, but I think that I'd be doing you a disservice if I tried to weigh in and give you guidance on this topic. I think it would be much better for me to refer you to a colleague that I know and trust in this area to make sure that you're getting the best care. Personally, if that was a provider that I was working with and they said that, I would think, this is a really great person.
Thank you.
Uh,
Yeah.
It's so important because overconfidence can really manifest in ways that I think most people wouldn't want to show up. It can read as arrogance. It can read as a sort of resistance to feedback, to sharing. I think it can be very alienating. So someone who is willing to admit, I'm not the expert in all things, it's funny. You wouldn't think that that would give you a lot of confidence in them, but it actually does. That's exactly what happens.
Yeah.
If we say that humility is the recognition that we don't have all the answers and there's always room for growth, it does encourage us, the person who is attempting to espouse that value, to listen actively, to seek feedback, to accept limitations. And I think many people would say that when you're working with someone like that, they're approachable.
Mhm.
They're easier to collaborate with, and they value contributions and show respect for the different perspectives of others. The thing that I'm a little worried about with this one, as someone who has been in the field for a really long time, is I have seen this thing that happens when I'm shadowing younger physicians and APPs,
Mhm.
where in their earnest desire to share and be collaborative, they almost overcompensate on this one. There's a lot of like, I want to hear what you want and I want to hear what you think. And listen, it is great to share. I want the provider that I'm working with to seek my feedback. But I think it can be done in such a way, especially for older patients, where they start to wonder, does this person have the expertise? Do they have a recommendation to give to
Yes.
me? You know?
Yes. And one way that I've found that works for me, and you'll have to tell me if you think this works in what you've seen, but I love giving the patient 2 options when there are options. So patient comes to me for a problem, and oftentimes there are 2, I would say, equally good routes that we could take to solve the problem. And so I'll say, option number A would be to do this. This is what we do. These are the benefits I can see from doing option A. Option B is doing this. These are the benefits. These are the drawbacks. What are your thoughts? And so I try to lay before them information. I'm bringing to the table my knowledge, my expertise, but I'm saying which one feels more true to how you want to proceed with this problem. And I don't know if that's right or not, but I agree with you. I've seen providers who it's almost like they want the patient to pick
Mhm.
completely and the patient is looking like, I have no idea. That's why I'm coming to see you. I don't know. And so I like that two
Yeah.
option, give them two options and coach them through that.
I like that a lot. And I would say anywhere between 2 and 3 options. Like, if there's 3, I would say, like, we've got an A, B, and a C. But I
Mhm.
love that you're giving options. The only thing that I would add is really just a reminder that patients can't always read our intentions. So, sometimes you just wanna be really deliberate with your wording and, to sort of frame it by saying something like, "Listen, I've got a couple options. I want to tell you which one I think is best, and I will tell you why. But it's not the only option. And as I'm going through these options, you might hear something that sounds like it's more appropriate for you. And that's okay. That's the kind of feedback I want. So let's talk about this together." And I wanna add that framing because just jumping straight into the options, it's good to give them those, but I want them to know that you're sharing. I mean, think about it this way. Most clinicians, especially in an outpatient setting, use a patient experience questionnaire that typically asks, did you feel included in decisions? So I want you to say it. I'm including you in
Yeah.
this decision.
You're literally saying the words, you're laying
Yeah.
it out as clearly as you can so they understand I have a choice.
Yeah.
I love that, Anne, and I love the way you said it. I need to write down exactly what you said so that I can use those words.
Okay. I wanted to come with recommendations. I told you I made a list.
Good. I love your list.
I love a top 5. So, as I tried to think about what are the most impactful ways that a provider can demonstrate humility, these were some of the things that I came up with. So, number 1, I feel like maybe people who are listening, there might be some groans, but just go with me. Okay.
I'm with you.
Okay. Number 1, be open to your patient experience, scores, and comments. And I
Yes,
know,
people are groaning right now. They are groaning out loud.
I know people are full of feelings. I've been in this field for quite some time and I have heard all of it.
Yeah.
So much of it. And I understand some of that feedback cuts. You read my bio and I used to do a lot of speaking engagements and people would get a critique from me for those speaking engagements. And I would take that stack of forms and I would flip past all the positive ones and I would look for the 1 or the 2 or the 3 that were negative, and I would think on those and stew. And some of them were absolutely hurtful. I remember one person said, "I didn't like your shirt at a presentation."
Like, oh, okay.
Thanks. I even once got a "you could stand to lose a little weight."
Oh my gosh.
I know.
Really?
I know. And listen, maybe that person was just having a really bad day. And unfortunately, the truth of human nature is that I didn't memorize any of the positive comments, did I? I just stuck with the negative ones. So, my advice to the providers who are listening, if you're in an organization that has a patient experience person, talk to them. Have them pull your data together for you. I will often do a personal data analysis for a physician or a mid-level provider, and I'll look at a lot of different things. Not only am I looking at the roll-up scores, but I'm looking at the frequency of responses. How often did you get ones, twos, threes, fours, or fives? And the majority of people, fives are the number one answer that they get back. And when I see people who are low scoring, it's not that they got a lot of ones and twos, it's that they got a lot of fours.
Hmm.
And so then what I do is I start looking by age, by gender, by visit type, by insurance type, by zip code. I mean, you can slice and dice data in all sorts of ways. And
Mhm.
I want to see where in your population, where in your panel are you getting a lot of those fours? And can I give you some recommendations that are based on that group?
Mhm.
So I personally think, yes, the data can be upsetting, but it can also have a lot of value and it can also be much more positive than most people realize. So,
Yes.
explore it, read it, see what you can glean, and remember that there are hundreds of people who never even answer. So this should be something that we use.
Yes. And I would say as a provider, Anne, the thing that bugs me most about these surveys and
Mhm.
scores is that they're so one-sided. And so, I mean, a patient can be an absolute jerk to me and be a nightmare, and then their voice is heard without the context of the whole visit, right? And so
Mhm.
that is frustrating. But the bottom line is that's how it is right now. And so, honestly, it is what it is, and like you said, our best move is just to learn what we can from it. For example, I forget what I scored, but it was on I do predominantly telehealth, and
Mm.
I got a 4 on not providing follow-up instructions. And we send out or an after visit summary. It was something about like the after visit summary or follow-up instructions, and we send those out, they automatically populate to the patient after our visit. But I wasn't verbalizing that to the patient. I wasn't saying, "In your email, you'll see follow-up instructions with me, how to get back in touch with us." And so from looking at my data, I was able to really easily say, "Well, that's easy. It actually goes out automatically. All I have to do is verbalize it to the patient."
Yeah,
And just like that, my 4 was a 5. Just by so it wasn't
perfect.
it made me understand that this is not hard stuff a lot of the time. Sometimes it's just these little tweaks that we can make and boom, we're
Mhm.
there.
And you're pointing out a really important thing here because it's so common for us to focus on the people who are upset. Because let's face it, they are much more memorable than the people who are quiet and well behaved. And, we start thinking that that's the majority when the reality is that, if you chase all the angry people, I mean, you're going to ruin your day. You're also not going to move the scores. It's a really small percentage of your responses. You focus on the fours. And Katie, I would also encourage you to think about what getting a lot of fours means for you. Like, that's not data that says Katie needs to completely change her approach or needs a total personality overhaul. That fours mean little changes,
Yeah.
small changes like deliberate wording choices,
Mhm.
and you will absolutely move that person.
Yeah.
I'm big into the data. As you might be picking
I
that
know
up.
you're a data girl. I love it.
And I love to refocus people because if the opportunity is the fours, and it always is, that is inherently a much more positive message than you're below the 20th percentile. We got to move you, or got to get better at this. Like, okay, fours to fives feels possible, you
Yeah.
know, 1 to 5 may be possible, but I would say it's not probable. And it's just I wanna make sure everybody knows I'm not telling you to ignore angry people. I'm just trying to tell you to not pour all of yourself into that situation because all those quiet, well-behaved people need to too, and it's
And they're
only gonna take
low-hanging
little
fruit.
stuff.
That's a
Yeah,
low-hanging fruit. Oh, I can tweak that. That's easy.
yes, absolutely. Okay, I'm so glad you called that out. That's
Definitely.
perfect.
Okay, number 2.
Okay,
Okay, so number
number 2,
1, remind me number 1 again?
being open to your patient experience scores
Yes.
and comments.
Okay, what's number
Okay.
2?
Number 2 is using language that grants permission, language that invites conversation, language that demonstrates value for the voices of others. Agenda setting is a really good way to start out by doing this because I see a lot of people. I do a lot of physician and APP shadowing. And so many people walk in and go like, tell me what brings you in today. And they have already told that to multiple people, first of all. So just makes us look disconnected. But also, this is a moment to start framing their expectations. If they have come in for a wellness visit, I can lead off that conversation by saying, hey, so I know you're here for this today. Here are the typical things that happen during a wellness visit. And I'm going to list those off. But then I could also say, we're sharing this time. So tell me what you brought for me. And I'm a big fan of the tell me statements. When you think about inviting conversation, granting permission, a tell me statement has power because it's like saying, I assume you have questions. I assume you
Mhm.
have concerns and needs and thoughts. Hit me. I'm ready. I'm available.
Yes, and this is reminding me, I interviewed a man who had had testicular cancer, and he said, some doctors said to me, "Do you have any questions?" And he said, "I honestly didn't even know what to ask." And so it was so easy just to say no, because he had asked me a yes or no question. So he said there was one doctor that said, though, "What questions do you have for me about your medications?" And he kind of guided his questions. And instead of saying, "Do you," he said, "What questions?" This man assumed that this patient is going to have questions. So I love that you said that. We need to frame it in a way that assumes they've got thoughts, they've got opinions, they've got questions, and we're open.
And when you think about the behaviors that need to, like if I say, Katie, tell me what questions you brought for me. I got to be comfortable in the silence. I got to sit there and
Yeah.
smile behind my mask and look right at you and go like, I'm ready. I'm demonstrating with my wording and my presence that I am available and interested in this answer.
Yes.
And, Katie, I'm so glad you brought up that gentleman because I love that that person was leading them, tell me what questions you have about medications. Tell me what questions you have about X, Y, or Z. Because I think that that is really directive. And when I work with a provider and I'm coaching them based on the gender and age group of their opportunity demographic, my recommendations are different. Because women come with questions. Women have questions. Women probably have a list that they've already made for you.
Yes.
And if you wait till the end to ask that woman for her questions, huge missed opportunity.
You're in trouble. Yeah.
Yeah. Men, not as much. And so if I'm coaching a physician who has men that are middle-aged and older as their opportunity, when we think about language that grants permission or normalizes, the phrase that I use is, "A lot of guys ask me this."
Mm.
And when you think about this one, how it would start is, ask the patient, "Do you have any questions?" "No, I don't really have any questions," or "I can't think of anything in the moment." "Well, a lot of guys with this condition ask me this. Is that something that you are wondering about?" And maybe I had no idea I should be asking about that, and now I know, and I can say like, "Well,
Mhm.
yeah, absolutely." Or B, maybe I was a little worried about this, but now that I've heard that other people ask this, then yeah, I feel a little bit more comfortable saying, "Yeah, I wanna talk about that."
Totally. You're kind of giving them the frequently asked questions of this diagnosis or this condition that they have. Let me give you the frequently asked questions. I love that, Anne.
Absolutely, and you as the expert, the person who specializes and knows the questions that people typically ask, anytime you can be sort of deliberate about that language, let's work together to make a decision. Let's talk through our options so you're informed, tell me what matters most to you with regard to this particular issue. You're giving them that permission and you're saying, you're in this with me. Like, we're going to do this together. That's a great way to demonstrate value for the voices of others.
Definitely.
You ready for number 3?
I'm ready.
Asking for feedback from those who know us the best.
I love this one, and I'm so
Okay.
excited to hear what you have to say. I love this.
Okay. This is my favorite one. So, when I'm doing the data analysis, like let's say that, Katie, I looked at your data and I have found that women 65 to 79 are giving you a lot of 4s. Okay. Do you know a woman 65 to 79?
I do. My mother.
Oh, okay. See, I also know a woman in that age range, couple actually. Here's why I say talk to the people who know you best. They're the ones who know how you communicate. They're the ones who know how you operate. They are the people who truly know you. And by showing a little humility and by me calling up my mom and saying, "Mom, I've been looking at my patient experience scores and I've found that I have an opportunity with women 65 to 79. And it would just really help me if you could give me a couple of pointers. I'd like to know, what would make you trust your physician? What are you looking for in a clinician? As a woman of your age and experience, what stands out to you? What makes you trust? What makes you want to go back to see somebody? And do you have any feedback for me as a person? Because I really want to make sure that I am relating to this group in the way that I'm clearly relating to other groups.
Yeah.
It just seems like I have an opportunity."
Yeah. And I love this. I love doing this with our friends and family who know us best. I also, really interestingly enough, I just posted a podcast episode with an interview with a medical assistant and her saying the things that meant the most that the provider she worked for did. And one of those things was asking for their input. And so you could ask your medical assistant, "Hey, I want to be the best clinician I can be. Do you have any advice on something that I could change?" But specifically, she was looking for a clinician that would say to her, "Is there a way we can make things more smooth around the office?" I mean, those medical assistants, they are the heartbeat of that office. They make everything run. You want to learn
Mhm.
something, you want your office to run smoother, ask your medical assistant what you can do better, and they know. They've already thought about it. They're probably all talking about it. So I just
Perfect.
love the idea of you
Mhm.
can ask for input on how you can improve personally. You can ask for how the office could run smoother. That's where the gold nuggets are right there.
Absolutely. Could not agree with you more. If you are a provider who has worked with a medical assistant for a long time, I'm sure you know them, I'm sure you value them, but how often are you really demonstrating that and asking for their input? Because they are such a wealth of information. Those that you've worked with for a really long time, they can know you as good as a friend or a family
Oh,
member.
yeah.
And I will never forget, I was shadowing a surgeon and I had done a personal data analysis for him. And when I laid out his scores for men versus women, I like to ask first, like, who do you think you do better with?
Mm-hmm.
And he said, well, I feel very confident that I do great with both. And I said, all right. So I laid out the scores and did incredibly well with men and not at all with women. And he was
Mm-hmm.
quite shocked by that. And we were in his office. He called out to his MA, had her come in and said, hey, we're just looking at my data. Who do you think I do better with, men or women? Without missing a beat. This woman said, "Oh, men. Yeah, I'm betting you don't do real well with women."
She
And
knew.
she knew. And he was floored. And it was such a perfect example of what you're talking about. Like, those medical assistants are worth their weight in gold, and they know you, and they could
Yes.
be a great source of input.
Yes.
I'll keep going. I'll jump to my number 4, which is just that I always like to encourage people to seek out education and resources from various viewpoints. And I don't mean go out and look for articles about why patient experience is nonsense, because I'm sure you'll find some. I
Mm-hmm.
mean, go out and read testimonials, especially from clinicians who have become patients themselves. I personally think the book In Shock, My Journey from Death to Recovery and the Power of Hope. It's by Rana Oddish. She's a young critical care physician, and she had that moment of being a dying patient herself. And I think first person accounts like that can be so incredibly powerful, but I also
Mm-hmm.
just think it helps us build perspective and empathy. You know, kids learn empathy skills by reading because they put themselves in the mind of a character. And if you seek out those books, those resources, When Breath Becomes Air,
I was just gonna say that one. Yep.
love it.
Mm-hmm.
The Lightning Catches You and You Fall Down. Like, there's so many amazing books that are out there. And I know it's hard to make time for it, but I do think it's really a worthwhile investment.
Yes. And you know what, Anne, even if you don't have time to read these books that talk about these experiences, you can have a similar experience when you're watching any show or listening to any podcast. If you can train yourself to ask the question, how would that make me feel?
Mhm.
And so whatever anyone is going through that you're listening to or you're watching, instead of saying, what would I do if I was that character on the movie, think of how would I feel? And you can train yourself to become attuned to others' emotions just by making that switch. That's a switch I've made. I read to our children out loud before they go to bed at night.
Oh,
And I've made that switch because I want them to learn to be attuned to feelings. And it's such an easy question to ask yourself or anyone in any situation. How do you think they feel? How will that make you feel?
absolutely. I love that you do that. And I'm also realizing I said the lightning. It's the spirit catches you when you fall down. I don't know where that came
The
from.
spirit, I mean, lightning would catch you also and make you
That's
fall down, so
true.
you're right.
Oh my gosh. I mean, there's so many great books that are out there, but you're right. I mean, just moving from what would I do to how would it make me feel
Yeah,
is huge. I'm gonna steal that. I really
do it.
like that.
Steal, and I steal everything of yours, so I hope
Oh,
you
I
steal
love it.
something of mine.
Okay, great. This is mutually beneficial, right?
Yes, it
We're
is.
sharing and learning.
It is.
Okay, number 5, what I like to remind people about, especially because you might be shocked by this, Katie, but it's come to my attention that providers are somewhat competitive people. A lot of times when I'm having a little data therapy session with someone, I get to hear about a lot of feelings, you know, the feelings of disappointment, the feelings of anger with regard to some of this feedback. And the thing that I like to remind these people about is that even though your ability to be a great interpersonal communicator is a big factor in your success in life, we don't actually get a lot of training in how to do that.
Yes.
It's pretty astonishing, actually, when you think about it, how little time we devote to sort of mastering the art of interpersonal communication. How much education and schooling have you gone through to become a great clinician, but you're not providing that care in a vacuum? You know, there's a there's another person, you're a person, and how much have you been taught how to relate to that other person, how to get them to open up? It's a difficult thing. That the tell me statements work well because it's actually pretty difficult to talk about what we need
Mm-hmm.
as a person. I mean, if you think about it, sometimes we struggle to tell even the people we love the most what we need.
Mm-hmm.
But using language like that can really encourage a patient to open up. But if you didn't have a mentor or a couple of key teachers that taught you some of those skills, you arrive in adulthood having learned your communication skills from your family and friends.
Yeah.
And there can be all sorts of stuff going on there.
Yeah.
So I think that we have to remember that no one is perfect at this, to acknowledge that we didn't get a lot of training. So we need to give ourselves a little grace. And part of focusing on humility, again, is remembering that we don't have all the answers. So we've
Yes.
we've got to give ourselves that grace and kind of keep going on the journey to get better and to become a great communicator.
Yes. And I think because communicating is an art, we say the art of bedside manners. Because of that, a lot of times people think it's something you either have or you haven't. You're either
Mhm,
good at it or you're not. But I grew up playing the piano and I've taught piano, to some young kids. I'm not great, but I can play. And I'm telling you right now, I think anyone could learn to play the piano who had a good teacher
mhm.
and who learned simple skills that they implemented consistently. I know that anyone could learn to play a decent song on the piano if they did those things. And so I think we have to remember that just like any art, the art of communicating, connecting can be learned and taught. There are skills to it. Just like piano, you have to know those notes. So it's not just fluff stuff. You have to learn these skills and then you have to implement them, but it can be learned. And that's what I love about it is like you're saying, taking time to read and to learn about this. It really does make a difference.
I think so. And I know again it's an investment of time. We're all busy. But you're right. It doesn't have to be like sit down and read a book, listen to a podcast, get out there and see what's available and remember to give yourself grace as you're learning and as you're trying things out. And remember, true behavioral change takes time and work,
Yeah.
to really make that happen.
And the cool thing is, and I'm gonna go out on a limb here and maybe put my foot in my mouth, but I would wager that the individuals who are struggling on their patient satisfaction scores may also have moments in their personal life when those closest to them are frustrated with the way that they communicate or connect.
That feels likely.
Does that feel
Yes.
right? I'm it's just
Yeah.
not backed by evidence, but that's what I'm thinking.
No, you're not wrong. I mean, I think there's a relationship there. And I also would say, and I tell this to people every time that I am teaching a class that is based in interpersonal communication skills, I will say that learning how to be a better communicator is like learning how to be a better human. And what could be more important than that? I,
Yes.
it does take motivation, right? You have to have the motivation to learn and to grow, but being a really great communicator has the ability to positively affect every area of your
Every
life.
area. Yeah, you
Yeah.
may find that your friendships go better. You may find that your marriage goes better. You may find that you get along with your children better. And that's
Mhm.
why I love this is sure it helps you get a better patient satisfaction score. But you know what? If those surveys went away tomorrow, I wouldn't be sad, but I would still preach this stuff day in and day out because I believe it is vitally important to finding joy in life. And so I hope that we can move it beyond the scores
Mhm.
and understand that this stuff is what makes life happy, is
I
connecting with
agree.
others.
Fully agree. Yeah, the scores. The scores are they'll
Right.
if you really make the change and make the investment, the scores will follow. But don't worry about those for right now. Focus on being the best communicator that you can be.
Yes. Well, Anne, thank you. Your 5 ideas are awesome. I love learning from you. The two standouts for me from this conversation is using the tell me statements. I love that. So instead of saying, what questions do you have for me, which is what I typically say, I'm going to say, tell me what questions you have for me. So I'm going to make that swap. That's easy. And then the other thing is asking those around me how I can do better and how we can be better. And then you have to ask, and then you have to listen to what they say and try to change. And so those are two things that I personally am going to work on. So I appreciate you. I appreciate you teaching me this.
Thanks so much. I appreciate being a part of the podcast. I always hope there's some nugget out there for a listener or two. But I would also caution you, there's like that saying, the man who chases two rabbits catches none. So try one thing. And if you feel like you get that ingrained, try another thing. After that, build on it. But focus on it and remember that it's these little moments where patient experience really lives. So thank you. Thank you for asking me and having me on your show.
Thanks for listening. If you enjoyed today's episode, the best way to support what I do is by rating and reviewing the podcast. Your feedback helps me reach more listeners to make an even greater impact. It would also mean the world to me if you would share it with a friend or colleague who you think could benefit from the topics we discuss. Together, we can transform the way we deliver healthcare by transforming the way we connect. Take care.